3, 2, 1, cut.
So certainly the conversation of having a CT scan has been for a very long time, more than a decade. When we, working in the emerge department, noticed that the acuity or the severity of what we were seeing in our emerge department was starting to change, we knew that part of that change also required a local CT scan. When West Lincoln amalgamated with Hamilton Health Science, certainly having that combination put a greater power or boost in being able to get that CT scan. And it's been a long, long wait, but very, very exciting.
Here we have the Siemens dual energy CT, which is state of the art. And what dual energy basically means is that we have these two tubes inside of here that come together, and what it does is when the patient is going through, it's a shorter amount of time that is needed for the exam to be done because everything gets done faster. Radiation-wise, if the timing is shorter, we'll use less radiation. It's going to go faster, less likely we will need to redo the images because now they're better. So overall, as Hamilton Health Sciences, we get all the requisitions for the patients, and then we book the patients depending on the waiting times and how acutely they are ill. And so adding another CT scanner at the West Lincoln Hospital means that we will be reducing the wait list. Now with the CT scan coming here, we're actually going to have a community elective for radiology residents. It's going to be a great experience, and a lot of great people came together to make this happen.
They put a lot of thought when they were building the rooms into patient safety, staff safety. The purple device would be a patient lift. So we have the ability to help support patients that are unable to move or transfer on their own, whether they be in a wheelchair or on a stretcher. Depending on the type of scan, again, they would be able to get changed. Some of them need an IV put in if they're coming from outside, which we would do out in our area. We have an IV insertion area. And then we would go ahead and bring them in the room and do the scan. It's a fairly quick procedure. Most of the CTs take no longer than 10 or 15 minutes at most. What they did was they allowed us separation between the chairs, but put these beautiful dividers with nature, like pictures of nature all over, but they're easily cleaned, which is really nice. So it's really nice, even though this is on the lower level of the hospital, to come in and feel like it's daytime inside. The group that was in here was extremely professional, and they were also extremely understanding about the fact that this is such an exciting thing for the hospital, and have been so patient and understanding with all the staff coming in to poke their head in just to see what's going on. There's been all kinds of different emotions going on around here. This is such a huge first for West Lincoln. It's a first for a lot of the staff too. Everybody has been extremely enthusiastic about it, which has been really nice to see.
Our hospital has always supported Niagara region. We've got patients coming from the Niagara region coming to our emerge department. These are patients that then get admitted. With the expansion of our surgical program, our internal medicine program has expanded. It's doubled its size and is expanded their urgent care program, where they're seeing people with very complex medical health care needs. That also helps to offset the load in the other areas in the region. When we think about how far we've come with this hospital, how hard we fought to get to where we are now, none of that could be possible without community support, both financially and both in regards to supporting the passion and recognizing the value that our hospital provides for our patients and our community. Without our community, without the foundation that supports that, this would not be possible. When you see this, it just indicates we have such a bright future ahead for us. It's very, very exciting.